So we heard earlier from Mavis, who many of you will have seen or heard before, someone who's come to the end of her Keytruda treatment, and obviously that's been very good for her, obviously. But I'm pleased to have had a volunteer in one of my clients, Pamela Stubberfield, who gives the perspective of someone who's at the very early stages of her Keytruda treatment, and she's being treated by Peter Schlosser, who you heard earlier. I think the deal was that Peter could talk a little bit about Pamela on the basis that Pamela could get her own back and talk a little bit about Peter. Her talk is to talk about the experience of going through the diagnosis, the treatment, and getting into the Keytruda track, if you like, and then finishing up with some thoughts about how that relates to the legal process, because one thing that's been alluded to once or twice is this treatment is not available on the NHS, and it ain't cheap. And for some people, where it's clinically indicated they need the treatment and they have to pay for it. Pamela and I agreed that I will say something first about her employment history and about how she was exposed to asbestos, so I'll read some prepared notes about that. So Pamela worked for a British oxygen company in South Morden, in South London, as a lab technician between about September 1961 and April 1963. In the first 3 months of that employment, she was engaged making and testing porous masses, in which I and Gemma Scott are now something we have a degree of expertise in porous masses. These are masses about the size and shape of a muffin, and they're placed inside acetylene gas tanks that are used for oxyacetylene welding. The key point here is, sorry?
Cylinders.
Cylinders, sorry. Key point here is that the porous masses were made by the mixing of cement powder, asbestos wool and water in a mixer which was open to the air so that dust and debris got into the air, and it was a mixing process. So for the lawyers and the asbestos industry regulations are engaged. Mrs. Stubberfield was not given any mask at the time. There was no special ventilation for this process. And that's all the asbestos exposure that Pamela had. After that, she went to work for the Paper and Board Research Council, then the Radiological Protection Service at the Royal Marsden in Sutton. She took a degree in physics and mathematics. She held a position at the Mullard Research Lab, and when she and her husband moved to Wantage, she obtained a job at the Engineering Sciences Department at Oxford University. She had a short stint at Oxford Instruments before joining the United Kingdom Atomic Energy Authority, working at the Joint European Torus project at Culham in Oxfordshire, where she remained until she retired. 2 points about this. This is a history of non-exposure, which means we can point to the earlier exposure at the British Oxygen Company. There's no sort of doubt about where the exposure occurred. Second thing is that I did a physics-based degree in Oxford, so this is really interesting for me, so I'm delighted to get the opportunity to go and see Pamela. So then we have certainty of exposure and then evidence there was no later exposure. So Pamela first contacted me in December 2016, and Pamela, perhaps you want to say something about how that happened.
Yes, I mean, I'd known obviously for years that I had exposure to asbestos, but I never really thought about it. And then about 55 years later, I got this mysterious pain in my back, and went to the osteopath, and she said, well, it's nothing, musculoskeletal, there's something inside there which needs chasing up. This led to a series of x-rays and CT scans, and they found antibodies for asbestos and blood sample. And then I was fast-tracked at the hospital in Oxford, and the nurses there have a great list of companies that deal with compensation claims, and they do encourage people to, take it to sue these people. And just really by sticking a pin in, we chose Lloyd.
All this money was spent on marketing.
However, Andrew hasn't said that when I told him about it, he was brought up in Wimbledon, which is just up the road, so he said, I'm interested, I'll take it.
Well, yes, and I did. Now, by the time I met Pamela, she'd been diagnosed with mesothelioma, but she'd not been identified as being a candidate for immunotherapy treatment at that stage, and of course she's receiving it now. And so how did you go from first being diagnosed with the condition to your flirtation with the atomic trial, I think it was. Flirtation is not quite the right word, I guess. Before then being drawn into the Keytruda part?
Well, I had 2 biopsies, but what's the name of the Churchill, something like that. Mine goes blank. One was at the point where the pain was, and they actually did fish out some bits of asbestos, which was gratifying because I thought this looks familiar. They also discussed cutting it out, but the surgeon said it was just too risky, so that was turned down. Then I had a second biopsy under general anaesthetic, which was up here somewhere, and they took out the sample which was tested for PD-L1.
That was at the John Radcliffe.
That was at the John Radcliffe, because that's where they do these things, yeah. Unfortunately, I had quite a lot of PD-L1, so there was no problem there. And then I had a phone call. A lot of my treatment has been phone calls. Dr. Moore called and he said, I'm afraid we can't really do anything for you more here, but would you be happy to be referred to Barts for the drugs trial? And that's when I first met Peter Schlosrak in November. And yourself.
In December?
You came in December. And then I had radiotherapy, generally on the back. I had a series of radiotherapy.
I think you had, 5
I had
sessions.
5 times, yeah.
And what was that for?
Well, presumably to just keep it from developing, I don't know.
So was that focused on the back, or?
That was on the back, yeah. Then in the middle of March, my left knee just packed up, wouldn't work properly, so I went to the triage, and I had an MRI scan, which showed that the growth had now moved to the spine as well. Dr. Eisenstein got involved then, and he arranged another second round of radiotherapy, which was based on the spine, very quickly actually. Then Dr. Schlosrak called, suggesting I said that the drugs trial was not really appropriate and I should go for pembrolizumab sooner because I was, in a serious condition.
Sorry, can you just stop there? By this stage, you've already had a biopsy, is it, that reveals the...
I've had 2 biopsies, the definite...
And the second one reveals the PDL levels.
Well, they managed
We did that in London.
And
the sample went to food.
okay. And so was that done as part of your NHS treatment, or was that paid for privately?
I didn't pay for it. Was it done under the NHS?
It's part of the legal. I think you instructed me to.
Well, we'll see. Maybe
It was done anyway.
But the cost of that test is about, Peter, how much is the cost of it?
Well, it depends on the pathologist. I mean, our place is £200.
Right, so £200 is
Yeah.
the first step towards consideration
Yeah.
for the Keytruda treatment. So you had your problems with the spinal cord and the knees, and then you went back to Bath.
And then I went back to Barts. Yeah, I was having I mean, one of the things that you probably know with mesothelioma is that you do attract a lot of water, the lymphatic system sort of breaks down, and I had a lot of trouble with my feet because they're not very good anyway. But I have had help with putting, you know, the bandage around your leg, putting it down. That's the worst thing. And a lot of massage, which has helped. You need to look after yourself, don't you? I mean, everything, just make sure that you're eating properly, because one of the things when I started the drug was that I lost my appetite completely. You know, everything tasted like cardboard, and my poor husband was trying to get me to eat. It was very difficult. So that happened. But then I started on having the drug. I first started it.
End of April?
End of April, yeah, 28th of April. So I've been on it since then.
And where did you have that first dose?
That was at the Rivers Hospital.
The Rivers Hospital is where?
Sawbridge,
which is up towards Stansted, is that right? It's leafy Essex. And you live in Wantage. So the journey is
2 hours at least.
2 hours at least each way. And did you stay over? Or you stay
We
over?
were fortunate that we had relatives that took us.
Okay, so you had a 4-hour round trip, and relatives roped in to do that
Yes.
for you. So it's not straightforward, even when the treating physician is based out of central London.
Well, I now get home visits.
Well, indeed. Okay. So the first dose, you had it through at the Rivers Hospital, then back home, and how did it make you feel? How was it?
Well, when you have the infusion, it doesn't hurt. I mean, you do feel a bit tired, particularly across here, but it's not painful or anything. You just sit there for half an hour chatting and drips in. Yeah, I did have. Yeah, the only really bad effects I've had of it are the lack of appetite. But I also got an infection and I started having hallucinations one night, which was very frightening. Unfortunately, I was due to go to a wedding the next day, but I never got there. So that was quite upsetting.
So,
And I had to have a course. I had a course of antibiotics. I had to go to the GP. It was a Saturday morning, of course.
what happened there? Did you have to go to hospital at that time?
Well, no. The Churchill said you can come here, but would it be easier to go to Abingdon where there was a doctor on call? And they sent him a message, and he dealt with it.
Right, so you went to Abingdon, and then, okay, instead of a wedding.
And I had antibiotics. The sort I can't remember.
And that resolved then in a day or two?
Yeah, and I was okay after that. And then since then I've had 3 more infusions at home. And I seem to be okay.
And you have
And the
another
problem with my knee seems to be sorted itself out. Apart from the fact that Peter's worried a bit about my liver or something like that.
Right, and has Peter explained the problem with the liver?
Well, so Pamela had some autoimmune hepatitis, which is one of the known side effects. So the immune system is attacking the liver, but we're managing to control that with some steroids. So actually, Pamela's on quite a low dose of steroids. So, but it's a side effect that has to be watched carefully because unfortunately some patients have died on the trials from liver failure. So you need to keep a close eye.
It's good to know.
I mean, that's probably why your appetite was going initially in the early stages, but in fact the last blood test we have, the liver tests are completely normal. So that's very encouraging.
And you have another infusion planned for next week, which will take us up to 7 over the period of 5 months. So that's more than 1 month, 1.5 months, something like that. Has anyone said how long? No, let me rephrase that, because of course Pamela has a case, and there are certain things that perhaps we shouldn't necessarily put out there until the case is resolved.
You haven't said anything about the case yet.
No. Not that I know. All right. Well, I'll speak a little bit. To say that BOC, British Oxygen Company, are a big extant company. They make medicinal gases, obviously oxygen, but a whole range of gases for all sorts of applications. And you see their lorries travelling up and down every now and then. If you look,
they supply all the hospitals.
They supply all hospitals, indeed. A well-established company, and so they're a company that is available to be pursued, whether or not we can find insurance. The point about that, of course, is the exposure occurred in 1961/2, when employers' liability insurance was not compulsory, and we would not have known at the outset that this company was insured for a claim like this in relation to exposure at that date. It turned out it was. I wrote to the British Oxygen Company, and Zurich Insurance wrote back, and I gave them details of the case and a copy of Pamela's statement saying how the exposure had occurred. I gave them information about the value of the case in general terms. So initially, of course, she hadn't started the Keytruda therapy, and we were able to put a case to them and say, this is the case, what's your response? The response was silence. So we issued court proceedings, served court proceedings, and asked for a hearing in front of Master Eastman, who was one of the judges in the specialist Mesothelioma list in the High Court. And they fixed a date for the initial procedural hearing, even before the date that the defence is due. It's a very rapid process once you get into it. The insurer only late in the day instructed solicitors who turned up to the hearing. It's a telephone hearing, but they turned up unprepared. And the master, it wasn't Master Eastman actually, it was Master Thornhill, I think. Thornett. And the master gave them a little adjournment to allow them to go and get instructions and to get on top of the case. And he gave them 2 days. So the first hearing was on the Wednesday, and he said, come back on Friday and we'll sort this out. And I instructed Gemma Scott to represent Pamela at the hearing. And she rang me up afterwards saying, well, we have judgment. And when you have judgment in the fast track, you typically get an interim payment of £50,000 to go a large way towards compensating for the injury itself. And this is something that will often be negotiated voluntarily in strong cases against known insurers. But what was unusual in this case is we put in a bill for the cost of the Keytruda treatment that Pamela had already had by that time. Out of her own money, her own savings, she paid some £14,000, and we got an interim payment not for £50,000 but for £64,000. This demonstrates sort of graphically how this kind of litigation can fund treatment that, at the very least, may do someone some good. But I think in your case, it's it's been a dramatic saviour, in that, without the treatment.
I wouldn't be where I am today.
Just by comparison, I had a patient about 2 years ago. I won't go into details because it got a bit messy. Tried my best. But basically the patient presented around July, August and had, when I saw him in clinic for a clinical trial, the tumour was already invading into spine. I mean, he had severe pain, was in a wheelchair, and had emergency radiotherapy that day. I mean, that's pretty remarkable. And unfortunately couldn't go on the trial and had chemotherapy, which, as I've said, doesn't really work very well, and died in December with the tumour going into the spine. So basically from July to December, that's the median survival.
Yeah. So in your case, Pamela, we have the situation where, when I met you first, you seemed quite well. You were certainly easily mobile. You moved around the house, getting me cups of tea and biscuits and so on, with no trouble. And that's, although your condition is better now than it was, you don't have that kind of fluidity.
No, it's gone down a bit.
So we're in a situation where there's a need for treatment, and it's not available on the NHS, but it is clearly effective in this case. It's not effective in every case. It's clearly effective for you, and we need to find a way to ensure you keep getting it when it's expensive. And so that's what the lawyers are for. That's part of what we do. And so that's where I'll be taking your case next. To give you an idea of the timescale, a fairly typical timescale, we issued proceedings in May this year. We have a hearing date for assessment of damages in October, in about 4 or 5 weeks, something like that. So we expect the case to be concluded in that timescale. So about 10 months after I saw you first.
But we really don't know how much money will be needed. Right, so I think that the point I wanted to reach was that point. How do the lawyers take it from here? But to give you the opportunity to say anything you wanted about your experience and how you found the treatment and getting to know what treatment is available and getting onto the treatment once it was available. As you all must realise, when something like this hits you, you think, you're stunned. Because I've been healthy and fit, which was good, for 55 years, and then something like this happens, and it's interesting. I've learned a lot, but it's something that you could really do without. But yes, I'm as much as possible, I'm determined to get fit. I just want to get over it. So, Peter did say that the total cost would probably be about $250,000 at one time. So,
That's assuming 2 years of treatment.
yeah.
That's based on the trial data from May, because the trial was 2 years maximum,
Yes,
and then everybody stopped.
that's right.
We don't know. This question is being looked at, Gus, in melanoma, isn't it? CRUK are sponsoring a trial in melanoma, because of course this could break the NHS budget. Indefinite treatment of a patient with melanoma. Just look at Jimmy Carter, who's 90-something. He had a couple of months and he had disease in the brain, and that was 3 years ago.
We worked it out to £1 million because you've got to take in all the scans and everything. Yeah, so much.
So CRUK are sponsoring a trial of melanoma. After 2 years of treatment, patients who go on the trial are offered, they're randomised, so half of them stop, half of them continue. I think that's the trial. I'm not sure if it's open yet, but they're looking at how long do you need treatment for? We don't really know, and melanoma is the first disease where that we've made the biggest progress. So we don't know.
No, you don't.
Some people stop early because they get side effects.
Yeah.
I don't know why Jimmy Carter stopped off, do you know? He had about 5 months and then they stopped.
So to wrap up this segment, it's a learning experience for some of us, I think, more than for others. It's something that we do without, and we're part of the picture of making the best of where we are and where you are. And so I'd just like to thank you very much, Pamela, for coming in. It was a long drive to get you here, not me, a long drive for the taxi driver to get you here this morning, and it's going to be equally long to get you back to wanting to see things, I guess, maybe a little bit quicker, is it? But I hope you'll have time to have a little drink with us and a few candidates before you leave the taxi, and everyone can show their appreciation.